Hi, my name is Dr. Raja Adnan Ahmed, and I'm making this video series of some commonly asked interview questions which you may encounter in the NHS. And this is especially for the medical interview, which the IMGs might be facing for the first time. And these video series is for the benefit of the IMGs. So remember, I'm not trying to give you any model answers. I'm just trying to explain what common scenarios or what common questions you might encounter in an NHS job interview and how you can tackle them. So please, you can listen to me, but you need to come up with your own answers and tailor it according to your CV and according to your experience. So the most common question you will encounter in an NHS job interview is that take us through your CV. And this may be the very first question they ask you. They might ask you directly that take us through your CV, or they might ask you in a twisted way, asking you to explain that why you're suitable for this job, why you're applying for this job, and why should they be employing you. They are basically trying to ask you about your experience and what makes you a suitable candidate for this job. Every individual doctor will have a different answer for this according to their CV, but you need to really read the job description of which job you're going for, because that is how you will tailor your answer according to that particular job. The other thing you need to remember, you need to have practice this question prior to going for an interview, and you must have an answer ready, which should be not more than 2 to 3 minutes, which should summarize your most important achievement, your most important skills, and what makes you a suitable candidate for that particular job. Maybe a wrong way to answer this question is to literally take the panel through your CV, which means that you start reading from your time before the medical school, then the medical school, and then your jobs you have done so far, and all the courses, all the exams you've been taking. That might make your answer very long, and you might miss some important point which the panel want to hear. So therefore, it is important that you have to understand that this is where you need to summarize your answer according to the job description and highlight the skills which you are going to present to that panel according to that job description. But remember, the panel already got your application form, which has all your experience and all your degrees and all your achievement already mentioned there. The reason they're asking you is that because they want to figure out that how do you see yourself fit in that particular organization or particular hospital or that particular specialty. I personally divide the answer in 3 or 4 different categories. For example, first I will talk about my clinical experience, then I will talk about my academic experience, and then I can talk about some personal achievements or some other things which I've been doing over and above my role as a doctor. The job advert of that particular job would have already given you the essential and the desired criteria which the panel is actually looking in the ideal candidate. So you can tailor your answer. For example, if you're talking about your clinical skills, you need to highlight that the things that have been mentioned in the essential criteria, that you are able to do that. If this is a job based on a ward for a medical ward, you are able to take history, you are able to conduct ward rounds, you are able to order investigations, you are able to identify the acute medical emergency and escalate them and treat an acutely unwell patient. And you can do that by talking about your clinical experience so far and what have you gained so far in your internship or post-internship experience, and why are you feeling that you are the right candidate, the right level to actually take up that job and step into that role without any difficulties. If you haven't done that particular type of job before and this is the first time you're applying for that particular specialty, there's nothing to worry about. At the junior level, we all start at a certain point in our career, and might be the first time we are stepping into a specialty. But there are some generic clinical skills which are applicable to all jobs when we are working with maybe surgical, medical, or on a psychiatric ward or in an accidental emergency department. So by showing your clinical experience, you are actually taking the panel in confidence that you are the candidate which is able to cope with that job without any major difficulties. So for example, if you're applying for a psychiatry job and you do not have a clinical experience or a job in psychiatry, there's nothing to worry about. You can clearly explain to the panel that although my CV does not have a psychiatric placement in it, however, I have been interested in psychiatry and I have been keeping my psychiatric knowledge up to date by doing various courses and attending conferences and reading the common psychiatric scenarios and emergencies which I may encounter. I have the medical knowledge to deal with any medical emergencies that might happen on psychiatric ward. And I'm a quick learner. I believe that I will pick up the skills required For a psychiatrist, very quickly with the help of your team and supervision, which I will be given on the ward. Likewise, for example, if this is a job in accidental emergency department and you haven't done a role in accidental emergency department before, you can still demonstrate to the panel that you are the right candidate for this job by demonstrating that you have done previous roles as an intern in surgery and in medicine, and you have the capability to identify and escalate any medical or surgical emergencies, and you can work under supervision, and you can take that role forward. In the academic section of this answer, you can demonstrate to the panel that other than your clinical skills, you have the passion and the drive to undertake activities which may involve teaching. It's not just about teaching the medical student, but you can set up teaching sessions for the multidisciplinary staff to improve the skill set of your team members. You are passionate about research. You can involve yourself into the quality improvement projects, and you have been attending courses and conferences to improve your skills over the time. And in the personal skills of this answer, you can actually talk about things you have done outside medicine. For example, I've seen doctors talking about their passion for hiking, for running, for different sports which they think will be able to participate in while working in that geographical area. People even talk about having a social connection and family connection in that particular area. Some people even go beyond and talk about things they've been doing, like they were part of any debating societies, if they were setting up a website, if they were running an online business. All of these skills will actually demonstrate to the panel that you are an all-rounded individual. It's not just about managing a clinical skill or clinical ward, but you have the skills, and you know how to work under pressure. You know how to manage complex tasks. Also remember, this question could be answered in a slightly different way, where you are just not talking about yourself or what you can bring that to that team and what your CV is bringing that, but also that what can you learn and gain from that team. In that particular area, your research of that particular hospital or that department is important. If that hospital has some specialist interest or specialist services that are working there, you can mention that. If that area is known for research in certain areas, you can mention that. If that hospital is attached to a university, you can mention your passion for teaching medical student and developing yourself as a medical educator. That will give the panel an understanding that you're just not randomly apply for that job or turned up for that interview, but you're actually doing the research and you actually find that the role very attractive, not just for the fulfilling that clinical need in that area, but also for your personal development. You can mention the most important courses you've attended, the most recent conferences you've attended, which you may think will be relevant for this particular job. You can also talk about any experience of team working, leadership, or any management skills which you think will be useful in that particular job. Be confident and genuine with your answers. You don't need to make up any stories to try and present yourself as a superhuman being or a super doctor. Divide your answer in small chunks of information, take some pauses, speak clearly, and also always trying to link your current experiences and your abilities with the job description and ideal candidate they are looking for. Also remember that if you have been shortlisted for a post, this means that they have seen something in your CV which they believe makes you suitable candidate for that post. Otherwise, they won't be interviewing you. So you need to go there with the confidence that you are already a suitable candidate who can potentially start that job. All you need to do is show that panel that you have the capability to actually take up that post. You can learn, you can show them the track record of your skills improving over time, and you can also show them the willingness that you are able to adopt to a new system and take up a new role with open mind. So remember, before going for an interview, you must practice this question. It will be asked, and it may be the very first question they are going to ask you. That why are you applying for this job, or take the panel through your CV. You should have an answer ready. You should be confident enough to show your skills and think that what differentiates you from a normal candidate. If you have done something over and above an average doctor, if you've done any research, if you have any more clinical skills, if you have worked in a specialist area which you think will be relevant for that panel, you must highlight in this particular part of the interview. because this is the initial question is where the panel's attention is more on you, and they are actually trying to establish that if you are the right candidate. If you tackle this question well, that will set up a very good scene for the subsequent questions which will be asked later on in the interview. Thank you very much for listening to me. I hope this was helpful. And in this series, I have answered some of the other commonly asked questions which you may find useful. So please have a look at the other questions in the series as well and give me some feedback. And if there's any particular question you think is difficult to answer in job interviews, please let me know and I'll see if I can make a video on that as well. Thank you very much.